Welcome back to Leap Into Business, the official podcast of the School of Business here at Lehman College. And don't forget, our School of Business here at Lehman College is the only School of Business at any institution of higher education in either the Bronx or Westchester.
An amazing School of Business.
An amazing School of Business.
We
I know. I
started
got to
talking
edit that
about
in.
it.
Got to edit that in,
And
Lawrence.
we have a Lehman alum.
A Lehman
here,
alum
too,
today, so
we have
even better.
We have to make sure that is.
Lawrence, you want to bring in our guest?
1,000%. Christina, welcome to the podcast.
Thank you.
I'm going to just rattle off some of your flowers here, and you're just going to have to deal with it. I'm just going to do it.
Oh,
right?
my gosh.
We always do this every episode.
Oh, yeah?
Christina is the Chief Executive Officer of NYC Health and Hospitals, particularly CEO of Lincoln Hospital. Over 29 years of progressive leadership, experience in inpatient, ambulatory, clinical, and ancillary services. She began her caseworker career and advanced through various leadership roles, including serving as CEO of Metropolitan Hospital from 2021 to 24. She is known for her visionary leadership, fostering innovation and operational excellence, and creating a culture of authenticity, kindness, and transparency. I saw a little bit of that as we were walking here. Passionate about improving access to healthcare, recipient of numerous honors, including the Government Service Leadership Award. She holds a bachelor's in social work right from here, Sean, right from Lehman College.
Right here, Lawrence.
Right
Lehman
from here.
College,
Right from
an
here.
alum, back for the podcast.
She also has a master's in social work from Fordham University, right down the block from us. And she also has a master's in public administration from Baruch, which is one of our sister schools. So welcome, Cristina.
Thank you. Well, thank you for welcoming today. It's a pleasure for me to be here, Lawrence. Thank you, Sean, for that. And it's definitely very meaningful for me to be back here at Lehman.
Excellent. And we know this is your second time you graced us with your presence on stage, so we thought it was only fitting to bring you back for the podcast.
Just don't charge me rent.
All right. I'm going to jump into these.
Okay, never mind.
I'm going to jump into these hard questions.
Uh-oh.
Let's get rolling.
All right. Cristina, talk to us a little bit about how your education got you where you are today.
Yeah, I mean, growing up interesting, I wanted to be a lawyer first, but I changed career path. I started in high school, and I was kind of going through some challenges, and it was a little difficult, and I encountered some people that were very instrumental, very helpful in my path and realignment on make sure that I was in the right path, and taking care of my classes and making sure I was showing up. And I felt that was something that I could do, similar, So I wanted to make sure that I took similar career, and I became interested in doing social work.
Right.
And from there, obviously, I started exploring opportunities. And Lehman was actually one of the last schools that approved me. And it was, but yeah, it was rough.
We can cut that out, right? We can cut that out, guys.
Yeah.
Okay.
But it was the school that I chose to take my journey
Right.
in education. Yes.
Excellent. And we're happy to have you. I was talking about how instrumental 95 was with the people that graduated in 95.
Oh, yeah.
Yes.
Absolutely. And so in your career, right, you've obviously worked in pretty much every type of social healthcare job, all the way from caseworker up to CEO. So in that context, are there any pieces of advice that you would give to our students now who are here at Lehman, graduating, having internships, and are overall, entering the workforce?
Yes, definitely. I have an advice. I think that the students cannot let the fear drive them. A lot of the times we're so concerned about trying to find the right fit that we get overwhelmed. And I had to try a lot of different jobs. And you just have to make sure that you do the right thing in every position that you get. Don't get overwhelmed trying to identify, get internships, get fields that are aligned with your passion. Make sure that you do that so you can kind of explore if you're on the right path. For instance, I was able to do my social work and then do my internship in social work. But at the same time, I was doing work outside of that. I had to support myself and support my son. So I was doing work that had nothing to do with my, my field or what I wanted to do in the future. So don't lose track of that. I just encourage everyone to make sure that if it's possible, trying to find something. For instance, I was doing work that was retail work, but you dealing with customers.
Yeah.
You're dealing with people. So
Exactly.
even though in social work you're dealing with people, understanding some of the impacts in the social environment and all that. But doing retail work, you have to be customer friendly. You have to interact with people. Just do it, the best way possible, because everything is
Those skills are
practical.
transferable.
Practical
And, yeah.
skills. Yes.
And every guest on our podcast, Lawrence, has always mentioned how important having those person-to-person conversations are, right?
Absolutely.
In every field, be it education, healthcare, technology, any of those fields.
Yep.
And so, pivoting to that, healthcare is obviously in the midst of an ongoing transformation, right? Augmented by any number of things, but new tools and applications like AI and other types of tools of that kind. So in that context, are there any tactics or ways that you and your team are best able to stay up to date on the tools themselves and then on how they're changing healthcare?
No, absolutely, Sean. It's definitely true. In healthcare, there's so many changes. We have to be on top of the new technology. We have to make sure that we get the latest technology so we can provide the best services to our patients. Back like a year ago, 2 years ago, it was just when we were exploring opportunities for health and hospitals to have robotic surgeries. I mean, some of the hospitals have completed more than 200, 300 surgeries in robotics, so that's definitely managing and leveraging technology. We talk about AI. I mean, there's a lot of different programs or platforms that we need to be cognizant of, that we can't just look the other way. Technology is here, and we definitely have an opportunity any time that we can use technology to better our processes and our quality of care that we provide for the patients. We should adapt to that. Go to training, go to in-services, make sure that you are always being competitive and putting yourself out there.
And so, on that point, Lawrence, really quickly, I think it is kind of safe to say that healthcare is obviously focused on patient care, patient outcomes, but there are other opportunities in healthcare, right? So that for any students here who are interested in more of a quantitative field like mathematics, computers, that there are opportunities there also.
Oh, absolutely. And that's always something that I highlight to the younger students. I tell them, because a lot of the times people think healthcare is just being a doctor or a nurse.
Right.
It's a lot of other services that we rely on. In order for the doctors and the nurses to be doing their job, you need an IT support. You need, obviously, we need a billing team to make sure that we can at least get the revenue that we deserve for the work that we do. But there's a lot of other disciplines and professions that are important in technology and behind the scenes. For instance, podcast is something that you guys have adopted, but we also need technology like that to do video editing, to do, because we use social media, promoting, marketing. The hospital rely on all that as well. It's
Good
not
point.
just the component of, okay, we do the work, but if we're not putting that out there, and people would not know what happens in the hospital. So everything is relevant. All those technologies relevant. All those social media,
I love that.
Yes.
I love that. Yeah. I'm going to pivot a little bit, Cristina. I've heard you say this when you were here, when you spoke last time to our students, about focus on the well-being of your staff and drive positive outcomes for patients. If your staff is doing well, patients can do better by making sure the staff is positive. How did you learn, and I know you talked a little bit about your social work career, can you dive a little bit in the importance of caring for the people that you lead and the impact that you have, the impact that has on your team?
I definitely know you were paying attention, Lawrence. Hopefully you were taking notes.
He's always taking notes, this guy.
Right?
Always.
No, I can tell for the questions. But no, definitely my experience has been very positive in terms of that. I see the difference. I've been kind of using the same methodology across every hospital that I go to. Lincoln is kind of my fifth hospital in the system. I work in a healthcare system that is composed of 11 hospitals. But people are people. So, and I see the difference it makes when people are disengaged or demoralized.
Right.
So what I always try to do is to make sure that I bring in a series of, I call it strategies, because it's different things that I do to make sure the staff feels supported, that they feel that they're the main focus. For instance, in orientation, right? I do orientation and I acknowledge, I go in and I give an introduction. Obviously, I thank them for choosing Lincoln Hospital. I tell them what we're all about, the expectation, everything in terms of the expectation of the culture of the hospital. But I tell them that they're number one to me. My focus is, my job is to facilitate the work. And they don't hear that a lot, especially from a CEO perspective. My job is to make sure that the staff feels that I'm there to make sure that they feel engaged, that they feel excited to come to work. The last thing you need is for an employee to feel miserable. And I even joke, because I think I'm funny sometimes too. I even
So
joke,
do I. No one else laughs
you
usually.
see, Sean, you're competing with me, I know. But I tell them the truth is that, yes, we know patients are first, and we're taking care of patients, and we're improving patients' lives. But I don't think at that point I have to tell them that. Somebody has to make a commitment to the staff. And that's where I come in. Because at the end of the day, I have seen it throughout my experience and my years in this healthcare industry, that if you make the staff feel value, and if you make the staff feel excited to come to work, they're going to come in and give it more than 100%. And indirectly, of course, they're going to be good to each other, it's a good environment, they're going to be excellent to the patients, and they're going to be committed. And so you can't duplicate that. And what is the purpose of me coming and telling you the obvious? Patients are first. Okay, that's okay. I hear that every day. But what about me as a person? What about me as a human being? And how is that being considered in the big, spectrum of everything? Yeah,
and that's a good point. And so one of my questions to that is, because I think a lot of your staff live in the community as well, too.
Oh, yeah.
So for that reason, if they feel valued, right, and the people that come in are in the community, then it's just this whole kind of circle of kind of value and accountability in the whole thing.
I agree.
So
I agree with that.
I did have another question to ask. So I know the good work you did at Metropolitan for those 3 years.
3.5.
3.5.
We're not counting. I'm just kidding.
When you have that kind of momentum, and then a challenge like Lincoln comes, right? Like how, because you're like you have this thing going, you're putting your fingerprints on Metropolitan, everything is going to staff, and then they come and say, okay.
Have you been talking to my therapist? No,
then they come and say, Cristina, like, we need you to sprinkle some of that magic dust on and bring all of those things that you brought to Metropolitan, to Lincoln. What kind of challenge is that for you to go,
Oh my God, that's a very good question.
That is a good question.
It is a good question.
That's a good question. And it's not even on
the
the script
no,
either,
let me
man.
tell you.
Going off the rails here, man.
I'm just, because we're in this space. And
but that's a good question. So obviously to me, and most of the staff don't realize that, to me, it's shock just as it is for them, obviously, because I come into a new organization, but I left an organization that I was making a lot of improvements, and I felt like we were in a great path, and they continue to be in the great path, because I make sure that everybody is doing their work. It's not just because of Cristina's show. They are high performers. But coming in is kind of like disrupting that flow right now, and then I have to regroup with myself, my strategies, my group, and coming in and assessing what we currently have for Lincoln. It's a whole new environment, new group of people. I need to make sure that the quality is there, that the performance is there, that the technology is there.
Absolutely.
And making a full assessment to see what I need to do. And I don't have a lot of time. I have to do that right away, because I'm there expected to perform right away. And the staff is watching me, watching them. So they're watching, like, what are you bringing to the table? And it's not about me. I'm just looking at what they have and how I can add value to that. It's simple. But yeah, it's not easy. But you know what? I tell everyone, it's easier said than done. If I tell you that you need to adapt to change and immediately, pick yourself up and move on, I have to lead by example, right? So I had to do that. I have to make sure that I was able to adapt and understand that that's what happens in healthcare. It's not, things don't stay the same. Every day there's a change in healthcare.
Absolutely.
Every day. So I needed to lead by example and just deal with that and adapt and regroup right away and be able to implement the changes.
I love that.
Well said. And I'm going to jump around too, Lawrence.
Okay,
right?
go ahead. Yeah.
So the healthcare is obviously very patient-focused, right? But on the other hand, it's a business.
No, absolutely.
And so what tactics and what sort of frameworks have you used during your career to balance that empathy, right? Focused on patient care, outcomes, obviously, and also the kind of cold actuality of it, of that bottom line. Are there any ways, mindsets ideas that have helped you?
Yeah, no, I mean, I think, again, going back to, I think, and again, my main focus has always been the people.
Right.
Because everything else we can always change and improve and enhance. I always try to take a perspective of, like during my assessment, I incorporate information. We need to use data, right? Because it has to be an objective assessment, objective decision. So I use data, I use conversations, I do my own assessment, I talk to everybody involved in the teams. I make sure that I don't get one perspective, because even though I have a cabinet, I don't, and they know I'm very transparent. I tell my cabinet, I have conversations and I rely on some of your information, but I don't rely solely on your information. I have to make my own assessment. I always have creative forums where I can talk to the staff directly, because I need to hear the perspective.
Right.
Because sometimes, at the top we make assumptions that things have either the communication is going down or is communicated the same way and aligned with your message. And sometimes it doesn't happen, and for a lot of different reasons. But I need to make sure that that's happening, that my staff understand why we're moving in certain directions. And if they have any input in the conversations, I like that.
Right.
I like people to feel empowered to share some of the thoughts, because my position has always been that the staff knows best.
Right.
They really know. You guys are the experts.
Right.
For instance, you have certain expertise. I can come here just because I happen to be your boss today doesn't mean that I know more than you do.
Right.
Especially in your fields.
Right.
So I need to listen to the experts and take input from that. And based on that, total information, including data, including everything, including information from my cabinet and observations, then I usually make assessment and make decisions.
Right.
And you're right, Sean. Sometimes the decisions are not necessarily always, they're tough decisions.
Yeah.
But and I take this opportunity to tell everyone, sometimes being in leadership positions is not easy, and I always say that because everyone wants to be a boss, but sometimes it's not easy. You have to be comfortable to make tough decisions, and it's thinking of the betterment of everyone. It's not just
Right.
because this person likes you or that person likes you. It's not about that. So what is the best thing for the organization?
Right. Right.
No,
I love that.
and I think all of that sort of does pivot directly into my next question, right?
Okay.
Here at Lehman and at every college, but even more so here at Lehman,
Absolutely.
our main focus has been trying to build in some of those business competencies, right?
Okay.
Critical thinking, dealing with high pressure situations. So having that input, transparency, that's all great. But in a crunch moment, right, of high stakes, high pressure, obviously in healthcare there are people who are being impacted by the
Of
choices
course.
by the choices you make. Is there any one instance or one example of where you were able to sort of bring in that external data balanced with your judgment to help you make a correct choice under a high pressure instance?
Oh, that's a very good question.
Oh no, don't be so happy about it,
No,
Cristina.
I'm very excited
Oh man.
because it's so many instances. But in terms of bringing all that into play, I mean, I do a lot of that on a regular basis. But for instance, when I first came to Lincoln, I happened to come in a situation where I came in and Joint Commission came in. So imagine the staff feeling all that pressure,
Right.
where you have to go to a regulatory entity who's doing assessment of all your processes, protocol, and at the same time you have a new boss that you're also concerned about.
Right.
What are they bringing? What is the expectation? And who is she? And
Right.
and then she's standing there next to the surveyors. So I tried to, at that time, just do observations. So I was kind of like in a position, okay, what do I do right now? I don't need to pressure the staff.
Right.
They're already under a lot of pressure. So I retracted myself. But by doing that, and I was already gathering information, right? I met with different teams because I saw I was able to observe responses, assessment, processes that I wasn't 100% sure was the best approach, but I'm coming into something. And after that, I was able to make some decisions of restructuring some of the departments because at the end of the day, I needed to make sure, you need to make sure that people are the right fit. And you need to make sure that people feel comfortable and are proficient in something. Historically, sometimes people are giving positions or titles that, for different reasons,
Right.
you're trying to help someone, they're being good, and you put them in some positions. And I always say you don't want to set up people to fail.
Right.
So
Right.
you don't want to put them in positions that they don't have the skill set or it's not the right fit.
Right.
And it doesn't mean that they're doing anything wrong. It means that you have to make an assessment, and that's why I feel that leaders are important, because you're looking at the bigger picture, and you're supposed to make that assessment. And just because sometimes someone is not necessarily performing the best, doesn't mean they're not the right fit for something else. And I think that's what I was able to do with the information that I had, the observations, the responses. I was able to move people,
Right.
not necessarily saying that there's something wrong with you, but maybe this is not the right fit for you because we need another skill set for that.
Right.
And that's tough because I just got there, and coincidentally, a lot of people complimented all the decisions that I made, it was impressive. And sometimes people have comments, but they felt that I was able to assess that
Right.
in a short period of time. But it wasn't just looking, obviously. I had to get some information.
Sure.
I met with clinical leaders. I had conversations. I looked at the data. And I made tough decisions that they felt, that maybe it was the right one, but they don't know how I concluded to those, to those decisions. But that's the way that's my everyday.
Well said, well said. And Lawrence, I mean, obviously for any students listening here, I mean, that's really a great summary of what leadership actually is,
Right.
right?
Yeah.
Coming in, trying to work with people, and then if there are people who aren't the best fit
Right.
in their current role, try to find them a role to have them grow.
Right. No, I love that.
That was great.
So I've been in healthcare. I spent 27 years this is my second career. So I spent 27 years in healthcare. Montefiore, Mount Sinai, Columbia. I ended my career as a healthcare IT director. So I love this podcast because I know that healthcare never stops.
Oh, no.
Right. It's one of the reasons why I ran over to education.
Wait a second.
Healthcare,
Wait a minute.
Is that a compliment or an insult? Wait a
Yeah,
second.
it sounded like
that's
Let's just leave this ambiguous? Okay.
there's more stability in education.
Oh, okay.
And
That was a better way to say it.
I know it's a
Okay.
better way to say it. You talked about your cabinet. That is your professional cabinet.
Yes.
That is your professional cabinet. You and I know some mutual people that Margie Collin that we know that I've worked with for a long time. I always know leaders in your position have what's called their personal cabinet. There's a cabinet of mentors. These are a cabinet of people that you rely on. These are a cabinet of people that have been going with you for the longest. Even if some of them are administrative assistants,
Yes.
they just know you. Talk to me a little bit about mentorship and why are you smiling?
Because you've been talking to people.
Talk to me a little
Does
bit.
his homework.
No, but it's true.
Talk to me a little bit about your mentors, how they influence you. Talk to me, because I know, and for people that don't know, a cabinet, as a CEO, a cabinet is all your senior leadership.
Yes.
And you guys kind of come together, like similar to our president has a cabinet here, you come to make decisions. I know that how that operates in healthcare, but I also know from leaders in healthcare that they have their own cabinet.
Right.
And that cabinet, sometimes they're talking to in the car on the way home.
Yes.
Because some decisions have been made. Talk to me about your cabinet, your personal cabinet, your mentorship, and the impact it's had on you.
No, absolutely. I think that and you're right. I like the fact that you mentioned some different titles because people make assumptions that because you're a CEO, your cabinet has to be composed of people that are above you.
Right.
And it's not necessarily so. It's people in different fields sometimes. But you need that wide perspective. I do have a cabinet unofficially, a group of people that are very concerned, the overall of the Cristina Contreras, right?
Yep.
Professionally. And I do have reliance on people that know me because sometimes you have to kind of like walk through certain things and understand that you are actually being objective and that you're making the right decisions. And one of the things that I do is rely on people's perspective. I listen to people. Like I mentioned to you, I listen to the staff, I listen to my cabinet. Ultimately, I make the decisions. And that's one thing that people need to know. I make all the decisions and I deal with the consequences, good, bad, whatever, indifferent. You need to know that when you make decisions because you can't hide behind decisions.
Right.
You have to own them. You have to
Right.
be responsible because you are impacting people's lives, whether it's employee or patients or whatever. So, yes, professionally, we do sometimes rely on those unofficially cabinet of people that care, that have different fields, and they understand you and kind of give you some advice, overall advice about things that you need to consider, look at, pursued, not pursued, and kind of go in a different direction, the projection, how things look, how they might be perceived. Because, it's overwhelming.
Right.
People don't like to say that, but sometimes it's true. We do have a very career where it's a lot of responsibility, a lot of constant changes happening, and a lot of decisions that have to be made, and that you don't always have the luxury of walking through the entire process of decisions.
Right.
So that's why it's important to have a kind of a balance that help you put things in perspective in a different way. It doesn't have to be healthcare people.
Right.
It could be people of the
Right.
professions
Yeah,
that
absolutely.
add balance to your decisions.
How do you feel about the new generation of healthcare leaders coming up?
I definitely love to mentor people, and then people have approached me, and I do, as much as it's very difficult for me, I do make time. Even
Right.
if it's conversations, virtual, in person, I pull them in different spaces because I think it's important. I didn't have that. Growing up, it's like you don't see leaders like
Right.
that look like us. And not everybody, honestly, it's a very competitive situation. When we hire leaders, sometimes it's like, it's you don't know who to trust, and trust is an issue. And I was talking to someone, and I said, it's true. They said, well, you should know because it gets lonely on the top. And it's true. And that's something I say, I'm going to tell them so they know that if you
Right.
go into these careers, sometimes that's something that you have to deal with. It's
Right.
not, you don't have a lot of friends, and you can't trust a lot of people, and people gravitate towards you. And it's for a lot of different reasons. And it's not that people are bad. It's just that, people gravitate towards power. And sometimes you have to be cognizant of that because it's not, they like me, or, they're good, they mean well for me. Or it's not necessarily so. And you have to be comfortable in that.
Right.
You just have to know the difference. But I do love to mentor people.
Right.
I believe that we need to do more of that, and I think and do sponsorship because
Right.
sometimes we use, talking to someone is not enough, but giving them opportunities, getting them in interviews, talking about them to other colleagues, other people, so they kind of pay attention. We need to do more of that.
Right. No, I agree. I agree. Christina, I know you're deeply committed to public service, right? You could easily work at another hospital, another private hospital, easily. You have the credentials. We all know that. Talk to me about what kind of legacy you want to leave behind, because you are sitting in the Bronx, right, which happens to be number 62 on counties with poor outcomes.
Yes.
And so what you do here will not only affect with healthcare in the Bronx, but also affect the communities. I know you know that. Talk to me about why you're so deeply committed to doing this kind of work.
So it's interesting because I have to say this before I answer your question, but I worked in the Bronx for many years before I went to Manhattan, and working in the northwest section of the Bronx and working in the South Bronx, oh my
Very
God,
different.
it's a night and day.
Yeah.
And I keep saying that every day because I'm like, I didn't even know. I'm getting acquainted now. I'm getting to know a lot of different things and challenges that we face in the South Bronx. I'm not blaming anyone. I'm just saying the structure and the way that things are, and we have to be mindful of that because you're right. I definitely want to collaborate with the community. It's so important, and I always say that it seems like between God and my boss, they knew what they were doing, put him in this hospital, because I think they needed someone like me because not everybody really cares and understand the collaboration with the community, and I think it's integral. I feel, and I'm going to be honest with you, sometimes I feel like I don't do enough. Even what I do in the hospital, I feel like I'm not doing enough. So I'm trying to reach out to community organizations, and actually I have a meet and greet on the 13th with all the community organizations in the Bronx, but mainly South Bronx, elected officials, everyone, because I want them to know that I'm here and that I'm interested in knowing ways in which we can collaborate. Because you're right, I want to make a difference. I don't want to just be in an office, being a CEO, and I can do that.
Right.
I already have the job. I can sit there and just pretend everything is fine and do my thing and take care of my staff and everything is going to be fine. But that's not that's not what makes me feel that I'm adding value to my organization and to my community. I want to make a difference, and I want the legacy to be that collaboration, how to make a difference in the community that I serve. And I don't have all the answers. I have ideas. I'm listening to people that are already doing the work. I'm listening to people that are struggling, the challenges, how it's getting harder and harder. And I want to be part of the solution, whatever
Right.
that looks like.
Right.
And so I want my legacy to be that we can make an impact, not only internally with my staff and my team, but externally with the community and the outcomes for the youth.
Right. I love that.
Well said.
Yeah.
Well said.
Yeah.
So I'm going to pivot us, Lawrence.
Go ahead.
Okay.
I'm good with it.
Is there anything that you're passionate about outside of work that might surprise people? And just FYI, no pressure. I keep waiting for somebody to answer pickleball. So there's no pressure, though.
I know the guest you need to get on here, but we won't talk about that. But
Oh, okay. We'll talk about it off air.
I'm passionate about a lot of
Outside.
things.
Yeah, outside of work.
So,
That
so two
might
things.
surprise people.
One that is not going to be a surprise, and then another one that might be a surprise. So the one that's not a surprise, I'm really passionate about serving and volunteering for the National Dominican Day Parade.
Okay.
I really am passionate about that
heard
because
about that.
being that I'm Dominican and
Absolutely.
currently the chair, and I love to elevate and promote, the Dominican contributions. But what do, I'm passionate about is cooking. I love cooking.
Nice.
I
Now
love
we're talking.
hosting. I love making margaritas. I've been told that I make very good margaritas. So I don't know. I guess I have to make some for you guys. So you
Absolutely.
can
Yeah,
I was just
judge.
going to
It's
say,
on
got to bring them
camera,
next
yeah.
time.
Yeah, maybe next time in the podcast with the
Yeah,
margaritas.
We'll have it right here.
Yeah,
I was
Maybe
going to know.
we don't post that one. But
my intel didn't serve me right on that.
no, but yeah, I'm passionate about cooking.
Nice.
Any
Love it.
favorite dish? Like,
No, I mean, yeah, I'm glad you asked that, Lawrence, because it's
Lawrence
Spanish
knows.
food.
Right.
I'm not creative with Italian. I'm not
so
creative.
you don't look at anything like on New York Times will send something, make this
Like
dish.
the
No,
top
I don't
dish.
get
You
creative
don't
like that.
do-
No.
I get those emails too, actually.
Talk to me about rice and beans and stuff like that. I make all the Dominican dishes.
Okay.
I make Mexican dishes, but not other than that, I don't get creative.
right.
with
Okay.
them.
Wait, is it therapeutic? Is it that cooking is therapeutic for
Oh
you?
my God, you don't know. And I was laughing because when I'm stressed, I do a lot of cooking.
Right.
And then I have to pack and send it to people because it's
You
just
have too much food in the house.
too much food. I send it to my kids. I bring it to work. I send it to people.
Wow.
Love packages.
Right. I
love
love
it.
I love it.
I love it.
All right. Here's our last question, and I know it's been a rough interview. I'm sorry.
No, it's been great.
It's been fastball after fastball here. Just
I'm
whipping
waiting
them
for
in there.
the rough questions.
Okay, here's the rough question.
Yeah.
All right. This is our last question. There are 3 metaphorical bones in business. There is your backbone, which is your decision making.
Uh-oh.
There is your wishbone, which is your luck or serendipity. And there's your funny bone, which is your sense of humor. Which one of these business bones do you find is the strongest that you feel more comfortable using? We know you use all of them, but which one do you feel more comfortable using and why?
Well, I can't choose 2 out of 3,
Yeah,
right?
you could do.
Wait
All
a
of our
second,
guests.
Laura.
No,
Yeah,
but
yeah,
man,
make
We
it
always,
my own
we always
rules
hold
here.
them to one first, and then they
she's-
can expand.
She's a Lehman alum.
All right.
I get
we
it.
could just select
She's a
that.
All right, all right. Well,
but yeah,
the backbone, I do that all the time.
Right.
It's not my favorite, but I'm definitely comfortable making tough decisions.
Mm-hmm.
However, I have to say, I think I'm a comedian sometimes, like I don't get paid for that, and I don't think I can make a living, and people will be surprised, but I really like to make people laugh.
Right.
I like to interact. I think it breaks the ice.
Does.
It helps. Yeah. I mean, there's always a time and a place for everything.
Mm-hmm.
So with my staff, it's not like I'm making jokes all the time.
Right.
But I like to do that because
Right.
sometimes it makes them realize that I'm a human.
Right.
That I'm a person. That I'm
Right.
just not somebody out there that doesn't connect.
Right.
And I think it connects people. I think it eases you into things. We under healthcare, there's so much stress. We deal with so many things, and I'm sure in a lot of different industries, but I'm speaking for healthcare.
Right.
There's so many things happening, bad outcomes sometimes, good outcomes. We have patients' lives in our hands. We do great work, but people are stressed because we
Right.
take it seriously. I mean, it's not, it's not, there's all type of jobs. I'm not criticizing, but I'm saying healthcare, sometimes we're very stressed as it is.
Absolutely.
So making people laugh sometimes, it helps.
Helps a little bit, yeah.
Yeah.
Talk
Plus,
to-
I'm competing with Sean here.
Yeah.
No, not at all.
And talk to me a little bit about your wishbone. Talk to me about luck, serendipity. How is that? I know you're always prepared, and I know that. I'd say to people, we're here because we're prepared.
She brought notes with her.
I know. She's
Just
very
in case,
prepared.
yeah.
Just in case. Look at but talk to me about, the higher power got some of these things.
I always say, and people that know me know that I say this, I'm a blessed person, and I'm not religious person, but I believe in God, and I do believe that God gives me a lot more than I deserved, and I feel that I have a purpose, and I mention it because my recent job is Lincoln, but in general, everywhere I go, I feel that there's a higher power positioning me there.
I love that.
I feel that there's a purpose, and some people say, yeah, right, you want to feel like that to give yourself meaning, but it's true. I just, like I told you, I said I feel God, and my boss knew what they were doing, matching me in Lincoln, because I see the great work that's taking place. I have great staff, but I also feel that they need some of what I bring.
Right.
And I think that's how I'm,
Right.
bring. It's like a match.
Right.
So it can't be by accident.
Right.
There has to be a purpose.
Listen,
Or at
I
least
love that.
I want to feel that it's a purpose because it's a perfect match.
Yeah, I love that. I love that.
Well said.
Well said. And we're closing. And Christina, I don't know if you noticed, but this is our last episode of our first season.
Yeah.
So you are closing it out.
Closing it out with a great episode.
So
I
am I
think.
supposed to cry now?
I mean, just a little bit, if you don't mind. That'd be great.
Well,
No,
Sean,
but
I think we're
I
ready.
should reopen. I should open, not close.
Christina,
okay.
it was an absolute pleasure
Yeah.
having you
Thank
on the
you.
podcast.
Absolutely.
We will definitely have you back on again.
Yeah.
Thank
It
you,
was
guys.
a
I
real
love-
pleasure.
We can come on location too.
Yeah.
Oh,
we're happy
okay.
to do
Come to
it.
Lincoln. We
Yeah.
can
Oh,
always
yeah.
come to Lincoln.
I think we should do that.
Okay.
I
Let's do
think
it.
we should do that.
Don't tell me that.
No,
Dude,
no, I'm
we'll
serious.
go.
Get in touch with Barbara, and then we'll.
No,
we'll
no,
start
no.
talking.
Let's do it because you know what? We have a lot of things that we can highlight for you. We have a lot of different things that
Okay.
we're trying to make an improvement
Okay.
and making a difference in the community.
Let's do it.
We can start game
On
planning.
site
Yeah.
for season 2.
Promise.
I love it. I love it.
Thank you again, Christina.
Thank
Thank
you,
you,
guys.
Christina.
Thank you. It's a pleasure for me to be here.
Here we go.